Check, check. How's that looking? Is that good? Looks good? Good mic. Loud mic. Is that good? Mic 3. How's that looking? Second mic. Second. Okay. Mic number 1.
What, no song? All right. We'll start that again now that we have a microphone. Okay. I won't have to shout at you. Good evening. I'm Teresa Lukens from News Radio 590 KQNT and the host of Health Matters on KSPS. And it's my pleasure to be here this evening to start the conversation about suicide and our kids. Suicide is a tough conversation to have. It's a nationwide one right now, and so it's important that we bring it home to Spokane and begin to talk more about this. When I was growing up, this was a conversation we did not have. In fact, it was pretty much behind closed doors, and I know a lot of you from the same generation that I'm from, you know what I'm talking about. We just simply didn't talk about suicide. So this is an important conversation we need to have. It is the second leading cause of death for our young people ages 10 to 24. 4 to 5 teens who attempt suicide have given clear warning signs. Think about that for a moment. 4 out of 5 have given clear warning signs. We need to start recognizing those clear warning signs and stop this epidemic of suicide. By the way, we are streaming this program live on Channel 17 on Comcast, so if you have friends or family that couldn't make it tonight, you can send them a quick text and let them know that they can watch. Also streaming live on KHQ. And then later you'll be able to watch this on YouTube, on the Spokane Public Schools YouTube webpage. Well, that brings us to our panel discussion this evening. We've been collecting your questions. We'll also have a microphone available if you have some questions that you think about during the presentation, and we'll be able to pass that microphone around for you to ask. Or if you're not comfortable with that, I believe there's still some note cards available, Chris, is that correct? That you can still write down a question if you have one. So let's meet our panel tonight and start the discussion. We have 8 panelists who represent community agencies from our area. Seven Bustle is with Odyssey Youth Movement, sitting here at the end of the table. Stacy Okahara is Frontier Behavioral Health. Tom Cutting is with Sacred Heart Hospital. Sandy Skoke, Daybreak Youth Services. Chris Moore is with Spokane Public Schools. Shane Garcia with the Native Project. Jill Yashing-Sky-Wertman with Gonzaga University. And Jackie Smith, who is a junior at Rogers High School, representing teenagers. What we'll do is we have the note cards here, and we'll have a chance for 2 of the panelists to answer each question. So we'll try to keep this moving. And I think it's a free-flow conversation, so if someone else feels like they can chime in on the conversation as well with one of the questions, then feel free to do that. Panelists, you have microphones in front of you. Make sure you hold those nice and close when you're answering the questions. Our first question. Will talking about suicide or asking someone if they feel suicidal encourage suicide attempts? I see a shaking of the head. Grab the microphone and answer that question. Mm-hmm. Please.
I'm Stacy Okihara, and I'm from Frontier Behavioral Health. And there is no data that shows that if you ask somebody if they are suicidal, that's going to encourage them to become suicidal. It's better to ask them to get an answer so you can get them help than not to answer.
Stacy, what's a good way to approach that?
The best way to approach that is if someone says, I'm feeling suicidal, you want to ask them, do you have a means? So that's how would they hurt themselves? Do they have a plan? So what's their plan and how they're going to do it? The time frame. Do they have a time frame? So this gives you an idea of how urgent this situation is or how urgent it is not. Please continue working with them. If it's urgent, please get someone else involved, a parent, a teacher, a counselor, a professional that then can come in and help assist you.
Okay. And in fact, there is a follow-up question to that. Can you come right out and say, are you thinking about killing yourself?
Yeah, absolutely. That's actually recommended. That's a great way to ask that question. And I think what Stacy just said about how do you involve someone else, one of the things that we tell our students at Gonzaga is program a crisis number into your cell phone. Even if you don't think you might need it, maybe a friend will. So whether that be a local agency like Frontier Behavioral Health's First Call for Help, whether that be the National Suicide Prevention Lifeline. But then you always have a tool right there at your fingertips, because most of us in this room are never going to be experts in that. But then you can always reach that expert who can help.
Very good. A question, do I call the police if I can't get my child to go to the hospital? Maybe Tom, can you take that one?
Certainly. This one. Yeah, the answer to that would be yes, if the situation was such that as a parent you believe that your child is in imminent risk of danger to themselves and they're unwilling to go with you, then that would be the next step.
What should you tell 911 when you call?
Give as many details as possible about the situation and, kind of what thoughts your child has expressed, what means might be available to them, their intent, that sort of thing.
Okay. And Tom, actually, I think you should hold on to the microphone, this next one. What happens when someone is taken to the hospital if they're suicidal?
So when a patient comes into our emergency department expressing thoughts of suicide, they are initially assessed by our psychiatric triage counselors. So they do a risk assessment to determine if someone meets criteria requiring inpatient psychiatric treatment. If they do, which in general that would consist of being in imminent risk of harm to themselves or others, then from there they go either to our inpatient unit or another facility. However, if there's no imminent risk and it's possible to maintain safety in the community, then either our psych triage counselors or myself will work with the family on putting together a safety plan and coming up with referrals for outpatient resources as well, which is something we strongly stress the importance of.
Would anyone else like to, from one of the other programs, like to talk about what might be available other than taking your child to the hospital?
We recently at Daybreak opened an evaluation and treatment, and we also take kids that are imminently suicidal or homicidal, and there's a 24-hour number that they can access, and when they come in, they have to have a medical clearance. We do get a lot of kids from Sacred Heart, but they can refer themselves. They can have a parent refer them, and they're referred from schools and other agencies that because they need that treatment as well. And so once they're there, we do an intake, and then we monitor them and work real hard at getting that aftercare plan in place so that they can be more successful and not have to come back multiple times.
I'd like to respond to that just from a school perspective, and I think that I'm confident that I'm speaking on behalf of all educators that are listening to this. If your son or daughter is taken in for suicide, completion, attempt, being in, not for completion, for imminent danger, for attempt, and having suicidal ideation, I know, we all know that is a tough subject for you, but please contact the school counselor and share that, because what we can do as educators is we can create support plans for your children when they are dismissed from the hospital or from the inpatient treatment. The worst thing really for us as educators is not knowing, and we understand that you sometimes feel that there's a stigma attached to it, but we really need to know so that we can give your students the love and the care and the TLC that they need, and so that they feel that they have someone in the school that really they can trust and go to. We can just provide so much more support for them.
Seven, talk about what Odyssey has to offer as well.
Yeah, so Odyssey is primarily an after-school program focused on building community and bringing people together. We do have a support group once a week for teens and also a support group for our young adults. So we have two programs, one for 13 to 18-year-olds and one for 18 to 24-year-olds. And there's support groups in both of those programs. We also have case management available, which primarily looks like setting some goals. Goals oftentimes are around limiting self-harm or just setting in place a really healthy routine, for example, are some goals that youth might choose for themselves. We're also really heavily relying on our mental health focused organizations that we partner with and that we can refer to so that therapy can happen and other safety measures can be put in place, especially when we're dealing with suicide, thoughts of suicide or plans. A lot of times youth, once they become engaged in our program, feel a sense of community, sense of belonging, and oftentimes that can have a really preventative impact just in its own right.
And Shane, I'm curious too about the Native Project, what you have to offer.
For youth, we have a youth mental health program, and so we have kind of kind of it doesn't matter what door you come in approach to our services. So whether you're being seen for medical, dental, and the youth program, the substance use program, we try to identify all those risk factors, and we do staff in a multidisciplinary team with normally with a prescriber, and we have mental health staff that also staff with substance use counselors. So we identify a lot of those risk factors that are in place, and if the substance use counselor in addressing something, someone from the team is usually kind of keen into some of those risk factors, and definitely recommends that someone, even just a slight window of hopelessness or anything like that, is something that we try to pick up on. So we do work with a lot of the other frontier behavioral health and the other mental health programs in the community. So I think we do provide it just as much as everyone else, but I think the key is the multidisciplinary teams and looking at everything in the whole family unit, not just the children.
As long as the microphone's down there, Jackie, I want to hear from you quickly because I missed getting introductions from the panel, and that's my fault. But Jackie, I want to know why you're here tonight as a student.
I know mental health is like a really big kind of problem, and like suicide is a big problem, especially with teenagers. And I know a lot of people that have like been going through a lot lately, and I've known some people who've like made suicide attempts, and like I want to help people. I want them to know that, like there's things out there, like there's a whole panel here with organizations, and there's more to life than like the negativity that's going on in like the current moment.
You bring a whole different perspective to the panel and to the audience. Is something like this, what we're doing tonight, important?
Oh, like it definitely is, because like there's a lot of resources out there that like some of I never even heard of. And so I think if people like have the opportunity to come tonight and like learn more about what's out there, then they definitely should.
Okay, very good. Our next question, what is PCCA?
PCCA is the Psychiatric Center for Children and Adolescents at Sacred Heart Medical Center at our Children's Hospital. So it's an inpatient psychiatric unit for ages above 12 and below 18. And we provide psychiatric care in terms of medication management, groups. We have a licensed education specialist that runs a classroom there. We provide family therapy as well as some individual therapy work as well. And really the focus is on promoting psychiatric stabilization. So it's what's termed brief hospitalization. So typically the length of stay is less than 2 weeks, and during that amount of time, we're really working with patients and families to promote stabilization of symptoms and to also get things set up so that there's good outpatient services in place and stability can be maintained in the community.
Follow up to that, a parent wondering, what if my daughter is suicidal but PCCA at Sacred Heart won't admit her, but the behavior continues to cause alarm at school and home?
That's an excellent question, and as a family therapist, that's something I address a lot. It's not uncommon for a patient to be kind of in a difficult situation where they don't quite meet the level of acuity that would cause them to qualify for requiring inpatient psychiatric treatment. And so there are frustrations sometimes, and I work with a lot of families on how to navigate that landscape. The big emphasis that we try and push is the critical importance of staying engaged in comprehensive outpatient care when that's going on. So we try and get families involved with a WISE team, that kind of thing. We work a lot with Excelsior actually as well. They have liaisons that work with our emergency department. So oftentimes in those kind of tough areas, they're able to help out with respite care and that sort of thing as well. And, we do remind families that, yes, it is frustrating when, as a family, you feel that your child requires inpatient psychiatric treatment and, the disposition, the determination is that they don't and they need to go home. We always remind families, our emergency department isn't going anywhere, right? And, in the future, if things escalate, if you feel that things aren't safe, you can take your child back.
Okay. Sandy, can you follow up as well?
Well, I would go off of what he was saying in regards to, I think it's crucial for families that are in that situation and so frustrated to follow through with their outpatient, and not just for the child, because it's usually a whole family issue that needs to be addressed. And that is what we see as one of the primary things that is successful for families, is if they are involved in their WISE team or even going to Frontier for outpatient, and they're all involved, that will help them. But again, always that they are able to come back to Daybreak ENT as well as the hospital if they need to, if that doesn't stop.
Okay. Another question. Oh, go ahead.
One more thing I would add really quickly to that is a new program we've been doing through our family therapy team for patients that have discharged from our emergency department, patients, as you described, where there is still a concern. We've been doing follow-up calls to these families on an ongoing basis to, assess how things are going with getting outpatient services set up, and as well as, assessing if, the family needs any help with that. Because, I've personally done the research and, getting that program going, and when those follow-up calls take place, families are more consistent about staying plugged into services.
Well, and in fact, the next question, I think you may have answered it, but let's ask it. Where can families go for support if a loved one has attempted suicide or suicides and they have ongoing concern? That family support again.
In general, and, I'll say that, I say this wearing my therapist hat, I would encourage family members in that situation to seek individual as well as family counseling for, navigating that. Additionally, kind of turning to one's spirituality can be a great strength in those times as well. So speaking with your pastor, clergy member, is always advised.
Anyone else? Okay. What other inpatient options do we have for kids that are under the age of 12?
I feel like I'm doing a little bit too much of the talking here, but that is a really tough situation. I can speak to a program we have at Sacred Heart Children's Hospital called the BEST program. That stands for Basic Education Skills Training. And so that's what's called a partial hospitalization program, but that's for children ages 5 to 12. And it's a day treatment type model. We provide psychiatric med management, family therapy, parent coaching, and parent classes and that sort of thing. When full inpatient psychiatric treatment is needed, it's unfortunately there's a limit of resources on that. So in those cases, we end up referring families to either Kootenai Behavioral Health over in Coeur d'Alene or Seattle Children's Hospital.
Anyone else?
I just wanted to share that we're focusing a lot of on inpatient services, and I think we also need to focus about outpatient services, because there's a tremendous amount of outpatient services within Spokane County, within the city, and there's a lot of outpatient providers here. And I just want to make sure that you We talked about taking kids to the ER if they're in crisis or if they don't want to go. There are programs at Frontier Behavioral Health within the crisis department that will come to your home. You just have to first call for help or call Spokane Mental Health and ask for crisis response services. If it's not imminent danger, where they're just saying they have thoughts, but you assess they have no plan, they aren't running away, you can call us and we will come out to your house and do an assessment there. Frontier also has availability for you or your child to come in for a same-day intake for services and get right into service and start, if they need medication, to get onto medication. So there are services that can be provided on an outpatient basis for crisis situations.
Very good to know. How do you know the difference between teenage phases, hormonal, or an actual mental health issue? I think every parent goes through this. How do you know the difference if your child is moody, hormonal, or if there's an actual mental health issue?
Well, one thing I would suggest is to probably visit your medical provider to rule out anything else that might be going on physically. And I think a thorough assessment would definitely help to rule out some things. So, and either family therapy. So I think the approach to that would be to do assessments or even seeing a medical provider first to see if there's anything else going on.
Mm-hmm. Jill?
Yeah, I'd want to add, I think one of the things we've talked a lot about youth and coming from a university perspective and knowing that not every student chooses university or that's what they want to do. We also know that age of onset for some things is between 18 to 25. So there also is this critical period that sometimes is after what might traditionally be considered youth where things could be changing. And that, again, is medical providers and how to rely on others. Sometimes it's knowing your family history and what kind of genetic or predispositions might be there. So I think all of those factors potentially come in. But I want to add, at least from a university perspective or continuing education, that life transitions can bring on a lot of really difficult stuff. And so should this be something that happens early in somebody's life or early in their childhood, just because somebody has done a great job of using all the resources at that point and everything becomes stable, doesn't mean that that's always going to be that way. When major life transitions happen, whether that be changing of environments, moving, changing jobs, moving to university, moving to community college, doing a trade school, that changes your ability to cope. And so that's where those support resources are helpful lifelong. It's not just a temporary thing. It's often what's the long-term plan for my well-being and mental health as well.
Very good. How can I please.
So a lot of medical facilities now are kind of integrating behavioral health into their medical services. So at the Native Project, we have a clinic, and so when a family comes in or adult or a child comes in with their parent, the medical provider kind of identifies that, and we kind of do a brief assessment screening on the child and kind of help them get them in a direction that may be helpful for them, rather than, okay, my child needs counseling, to talk with the medical provider and see what all their options are and going from there. So I think you're a medical provider, and a lot of medical places have the behavioral health counselors there.
Okay.
Teresa?
Yes.
I'd like to speak on that too, on behalf of schools. Jill alluded to major life transitions. I want you to think of families that are a little bit more transient and they're moving from, like our K-12 kiddos that are moving from home to home. I want us to think about our students as they move from elementary to junior high, middle school, depending on what district you're in. And then that transition from 8th grade to 9th grade. Those are huge transitional times in a child's life as well. And so if you have a child that is struggling in some capacity, please connect with the schools. We have so many skilled staff members and educators in all schools in Washington State. Every counselor, mental health therapist, school psychologist, school nurse is trained in suicide prevention in Washington State. It's part of our WAC. And so please loop in your schools. If they're moving from elementary to middle, contact the school and say, I'd like to meet with the counselor, and say, this is what my child's been going through. and these are some ways to support my child. We don't want you to ever feel in any school that your child is a number. Kids are cared about. People go into education because they care about kids. But take those times, and especially from middle school to high school, we tend to back office parents, and those are the most critical times to come in and build relationships with the schools. And I don't know why it is a part of our culture, but we tend to back office parents as they enter high school, and it really is such a critical time with everything that they're exposed to. So, thank you.
How can I tell if my child's depressed? 7?
I am not the professional for that.
Okay.
Generally, so if I'm working with a young person, if we're working with depression in Odyssey, it's usually that somebody has already had that diagnosis, and so they're aware of that. And when they're talking with me in case management about, what do I do to manage this, they are already aware of that diagnosis. And then, so Odyssey does not have mental health staff, mental health counselors. So we trust the youth that we believe what they're telling us. We don't do any diagnostic work.
All right. Sandy?
I think that the most important piece to know about whether or not your child is depressed is to be really aware of who your child is, because children will change their patterns oftentimes when they're becoming depressed, but that's also adolescence, is kids go up and down. And so you've got to have that relationship and be able to communicate with them and talk to them and ask them those tough questions about how are you feeling, how are things going, and being connected with them. They can go from being straight A students to starting to fail. They can start changing their friends. They have a more sense of hopelessness. Their hygiene may change. Their eating patterns, their sleeping patterns can change. But again, to remember that can be adolescence as well. So what's really important about determining whether they're depressed is having conversations with them and being open with them about that.
To respond, I challenge adults not to pass judgment on children or adolescents that come to parents, aunts, uncle, some community member. We need to really trust our kids. And if they're communicating that they're sad, that they're hopeless, that they're thinking of suicide, we need to take that seriously. And as a former high school counselor, I practiced for 9 years as a counselor, and I had far too many students that would come into me and say, Mrs. Moore, I told my parents, like you said, I would prep them. We would role play how they would share with their parents how sad and depressed they are. They'd come back in and they'd say they didn't believe me. That they said I'm exaggerating. It's a phase. Get over it. And they would be so devastated. They finally had the courage to share. And we need to not pass judgment. And something that may not be a big deal to you as an adult can be absolutely devastating to an adolescent or a child. So we need to give the children grace. We need to listen to what they say. We need to respond appropriately with loving, caring, kindness, and an open heart, and really listen to them and then try to connect them to services.
And Chris, teenagers aren't always forthcoming. They will drop subtle signals or say things that they expect you to pick up on. What are some of those things that we do need to listen for as parents and caregivers and really tune into and understand that there's something we need to be hearing here? What are those warning signs?
So I think it was a good point was behavior changes is key. It'll be like withdrawn, not participating in family activities, and it's over a duration of time. And just like asking the question, if you're suicidal, asking the question, what's bothering you? If you can't talk to me, who can you talk to? Do you want to talk to your aunt? It's okay to talk to your, knowing who they go to for their support. Sometimes as a parent, the child is not going to always respond to us the way we want them to, and encourage them to seek mentors or someone that they're open with. And so it's opening that door for them to, be open to others. The behavior changes, and substance use is one thing that hasn't been really mentioned. So even some mild substance use could indicate some maybe some experimentation, but at the same time, they are engaging in that behavior for some, a lot of kids used to cope, to self-medicate. So ask the question.
Speaking to that a little more too, our family therapy team kind of put together, what we consider to be 5 primary warning signs to kind of delineate that a bit. And essentially what you're looking at is, looking for increased agitation, being more withdrawn, changes in sleep patterns, changes in social group, and, who your child is socializing with, and increased screen time. And, the important piece there is, not whether you feel it's, not a normal amount of sleep or screen time, or, whether or not you approve of your child's friends. What you're looking for is a departure from where they're normally at. And so that really puts an emphasis on the relationship building piece, right? Because when you have a good relationship with your child, and you're spending good quality time with them, you're more able to recognize, when they're kind of departing from the norm, or they've stopped engaging in activities they used to enjoy.
What are some of the phrases they might say, openly say about this, other than watching for the behaviors? Are there key things? I know this particular parent wanted to know what would they be saying out loud.
I'd be better off dead. You'd be better off without me. I just want to die. I want to fall asleep and not wake up. Nobody would care if I died. Nobody cares about me.
I can't do this anymore.
Okay, very good.
I'm so sorry I keep interrupting you, Teresa.
Okay.
I want to piggyback on what Tom was sharing about building a relationship. And, teens today and kids today, they really are so connected to their phones. And I think a lot of parents are feeling difficulties in building relationships with their kids. And it's okay for you to say, we're going to put the phones down tonight. And I guarantee you every child that is typically having a phone, that, it's a part of them, they'll fight you on it. But I challenge you to do that and encourage you to do that. Another thing that I encourage you to do is be cautious about asking yes/no questions. How are you? Good. How was your day? Good. You're not going to get your child to talk. So it's, tell me about your day. A question that I would often ask my own children is, tell me about your day. What was the high and the low? On a scale of 1 to 10, what was your day? Was a 6. Well, why wasn't it a 7? What would have made your day a 7? They're going to talk. Why wasn't your day a 5? What made it a 6? Tell me about it. Tell me more. And that's how you're really going to get your child to talk. So just, we so often, and benefit of the doubt, I think that we just are in the habit of asking yes/no questions, but we can train ourselves to get in the habit to ask open-ended questions. Tell me about, tell me more. What is that like for you?
I think also be comfortable with silence and waiting for the answer. We're not in a society where we want that answer, right? And especially if we think it might be an uncomfortable conversation, we're quick to go to a yes/no question and fill that pause. It's okay to sit and wait. I have a colleague who always says, count to 7 in your head, if that's what it takes to be able to be comfortable in that pause and wait and see what happens. Because if you fill that space, especially for your teenager, they love it, right? Because they don't have to answer. So don't fill that space for them. Give them that opportunity.
If someone talks about suicide, are they just doing it for attention? That's a tough one.
I definitely think that, like, when a teenager's talking about it, that's, like, kind of a call for help, because we don't like being direct at all, and we'll drop hints all over social media, and, like, we'll post whatever we post, and a lot of teenagers ourselves think it's for attention, but, like, we don't know how to express our feelings properly, because, like, we're hormonal and we're crazy, and we don't really know what to say, and then we also sometimes can think, like, you're going to let your family down if they know that you're feeling this down. They're going to blame themselves for it, but it's not the parents' fault. It's not anyone's fault, and I don't think anyone's, like, they want attention, but they're not doing it for attention.
You've seen things on social media, Snapchat, Instagram?
Yeah, like, people, like, they'll post, like, what they're talking about, like, I'd be better off dead, and, like, a lot of people don't, like, realize what they're actually posting.
What kind of comments do you see following something like that?
Well, sometimes people just say, like, hey, message me if you need someone to talk to, and a lot of people say, like, reach out to me, like, I'll help you. I've seen people just make their own posts and, like, if you need help, feel free to message me whenever you need to. Or, like, when something's reported on someone's committed suicide, random stranger will say, like, hey, even if I don't know you, like, add me, message me, like, this world still needs you.
Mm-hmm. Have you ever felt the need to call a professional after you see something like that, Jackie?
I've talked to people and, like, said, like,
Mhm.
are you in immediate danger? And, like, if I don't, like, know, like, any information about them, then, like, I don't really know how I'd report it. Like, I message them if, like, I see that, like, they are, like, in true danger.
Okay.
So I have a 16-year-old daughter, and I talk to her openly about suicide. I've raised my kids talking about suicide, and we have a very open relationship. And she will see comments like that far too often on Snapchat. And she will say to me, Mom, what do I say? And I'll say, encourage them to talk to their parents. We all know that probably a lot of our kids won't. Try to have them, share with a trusted adult. But I will also always have her give them the crisis text hotline, and that's to the number. And if you want to visualize your phone from the left-hand side going up, it's 741-741, and you text home or connect to 741-741. But what my daughter has done in the middle of the night when I'm not up to talk to her and she's helping a friend in crisis, my daughter has even texted 741-741 and said, I have a friend that I am trying to support. Can you help me? What do I say? So it's even been a tool that way as well. So we need to encourage our students to do that and use that.
I'll add too with the 741-741, there also are specific words that you can text. Say you're a student of color and you want to talk to somebody else of color who understands how your identity might be intersecting with your well-being, or you're an LGBT individual, or whatever that looks like. So that's one of the great resources on that text, is if you text certain words, it will then hook you up with somebody who has that expertise and that background around identities to really help, because I think that's oftentimes sometimes barriers. Is it somebody who truly gets all of the pieces that are coming into this, to how I'm feeling right now?
We talked about some of the signs of depression and what to watch for, but this particular question wants to know, is depression the only cause of suicide?
I'm sorry for interrupting, but we have a question from someone in the audience.
Can you tell me if that 741-741 is a Spokane County or Washington State or national? Thank you.
Nationwide, and it started about 4 or 5 years ago, and it started with about, I think, 30-some staff members. And as we know, kids do not pick up the phone and call. So we always say, first call for help, but kids don't call, but they text. And so as soon as that started getting in students' phones and they started accessing it, it grew like gangbusters. Now they have hundreds of trained therapists on staff, 24 hours, 7 days a week. It's an amazing resource. I don't know if any of you guys have, but I use it so much in my trainings and in my talks that I've tried it out. And they follow up immediately. It's an amazing resource.
Thank you. Getting back to is depression the only cause of suicide? Stacy?
Suicide's not a mental health diagnosis. It's a side effect. So no, you don't have to be depressed. You could have a diagnosis of bipolar and been depressed for a long time, and now you start feeling good. I mean, there's no one reason what causes somebody to be suicidal.
Anyone else with a follow-up? Okay. My daughter is concerned that her friend is going to kill herself. What do I tell her, and what should she do?
Well, kids have a hard time speaking out, have a hard time seeking out. So as the parent, I would suggest the parent to call, first call for help or call Spokane Mental Health and ask for the crisis response team and express your concerns, and we will reach out to the child and to the child's parents.
I want to add, I think it's also important for the person who's being told that to also seek support. I think sometimes, especially, we want to be help to our friends, but we're not the experts, but we end up carrying what they've shared with us, and that's really hard. So how can we also get those who are being shared with this information the help and support, whether that's through a school counseling system or external resources, but how do we also make sure that they have that support? It's really a lot to carry.
Tom?
I would add too that it's important to remember that your child, your teenager, is not a mental health professional, and it's naturally, as a friend, she might feel a burden or responsibility to try and tackle that issue herself or talk her friend out of it, that kind of thing, and that's not her responsibility to try and do that. And so, it's important to kind of remove the burden of that from her, and it's also, really give her positive feedback for, coming to you as her parent and, telling you what's going on.
And it's the one promise to break, because that's going to save a life. So any kids out there listening, parents, if the students disclose to you, it's the one and only promise to break. And sometimes it damages relationships. But in the end, we have to remember what outweighs the damaged relationship is the thought of saving a life.
Okay. When should someone be taken to the hospital for suicidal thoughts? Tom?
So, essentially, the hospital is the next step to take when someone is expressing that they are suicidal and that they are feeling like they cannot remain safe. And if they're willing to go to the hospital and stay safe until they get there, then that would be the next step. And if it's an acute enough of an emergency where you don't feel that you can keep them safe, even getting them to the hospital, then that's the point where 911 would be the next step.
Anyone else? What should I do if I find out my child has been cutting or harming themselves? Stacy?
Well, first you'd want to assess how deep they're cutting, if they need medical treatment or not. That would be a prime example of when they should go to the ER. It's also a time to talk to them about that, and I'd say get them into some outpatient counseling to explore more what's going on for them.
Mm-hmm. Talk about why a teenager might do that, what might be cutting themselves.
Sometimes they do it to relieve pain, the emotional pain that they're feeling, so they can feel it by themselves. There's lots of reasons that they could be cutting themselves. But again, you want to continue exploring that and see what's going on. And then there's risks of how people cut themselves. And the deeper they go, the more riskier the behavior.
I would just add, and this is part of our safety plans that we do at Sacred Heart, is the importance of making sure all sharp objects and knives, that sort of thing, are locked up if that kind of thing is going on, and finding out how your child was cutting, what they were using, and a big part of that is approaching it from a loving, caring standpoint. Because they're very likely to feel like they've been caught doing something wrong and that they're in huge trouble. And if that's the case, then they'll be less likely to tell you where they've been hiding a pocket knife or a razor blade.
And another thing to be aware of, parents, is if it's a warm day and your student is wearing long-sleeved shirts, and everyone else is wearing tank tops and short sleeves, take a peek at their arms. They can get so good where they're cutting. I had students that were cutting all over their stomachs, their upper thighs. So they would wear the shorts and the tank tops, but they are hiding it. So really try to be aware. And Tom, I love how you shared for the parents to talk with that loving kindness. Parents, you're not doing anything wrong if your child's cutting. I know, again, Mom had on here, we get scared as parents and we feel it's a reflection on us. It's not a reflection on you and your parenting. Please try to put your nonverbals in check and don't act shocked and just say, oh my gosh, I'm so happy that I found that out. I want to support you. I want to help you.
Jackie, I'd like to hear from you on this too, on the cutting issue.
I do think kids do it because it relieves pain for them and they don't necessarily know how to healthily cope with them. I don't think healthily is a word, but they don't want people to know what they do, and they think if they harm themselves they can hide it. But I mean, it can't always be hidden, and kids slip up, and parents shouldn't be mad. They shouldn't discipline their kid. They shouldn't yell at them, be like, why are you doing this? Why didn't you tell me? They should understand, and they should help them get healthy coping mechanisms and help them realize you're not a bad person because you did this, but we want to help you get better.
Okay, thank you.
I just wanted to throw in really quickly.
Please.
So self-harm behavior can be potentially linked to suicidal thoughts and feelings, but it's also commonly not linked to suicidal behavior or thoughts or feelings. So some of the other people on the panel talked about, a release of emotion, a way to get those feelings out, and oftentimes that's what we see in that behavior. So it is not necessarily that somebody is suicidal that is doing these things.
Very good point. Thank you. What are the best responses to a suicide threat?
We have another question from the audience, I believe.
A follow-up question? Okay, fine.
I just had a question back to the recommendation that if a student reveals to you, a child, whatever, that they are suicidal, you said to take them to the hospital. And my concern with that is I've been to Sacred Heart and I've been to the emergency room there. There's no way I can imagine that a student can take another student in there because they're under 18. Is there a way around that? And is there a place in Spokane that you could take somebody that's in that place that you're extremely worried about their danger and get them in immediately and get them in and call parents or whatever? I'm not saying anything bad about Sacred Heart. I'm just saying I've been there and it's slow and it's ugly, and if I was a student I would never want to go there. And I've been there. I've met people that are in there. So please tell me there's someplace better in Spokane that we can take our young people. Sorry, Sacred Heart.
I just wanted to interject here. So crisis response will outreach to the school. So there's many times that the school district will call us and ask us to come out and see a child at the school. They will either talk with the parents, see if they can get a safety plan. We will outreach to the homes. Wherever the child is, we will go. And then we can admit them to Sacred Heart or to Daybreak for services if that's the level of care that they would need.
I don't think there's too much more to add to that other than, unfortunately, one student, you can't check a friend into the hospital, right, as minors. So, again, this stresses the importance of getting parents involved as soon as possible in the process.
That brings up another reminder for me. I don't know how many people know this, but in the state of Washington, a child that is 13 and above can seek mental health treatment on their own, so they don't need a parent's approval to seek mental health treatment, inpatient or outpatient.
Thank you.
Thank you very much. So getting back to what are the best responses to a suicide threat, and I'm assuming this means maybe verbal responses. Your child says something out and out that they're going to take their own life. You take a breath. What then do you say? Because I think as a parent, the first reaction for me might be to overreact or become shocked, or probably the inappropriate way to respond. So how would you respond?
Well, I think you would take a breath, like you said, calm your nerves, and sit down and ask them, tell me more about how you're feeling. And in that conversation, and that's an open-ended question, like Chris has talked about, not asking yes or no questions. In that conversation, then asking them back to, do you have a plan? What is your plan? But making it more of a conversation instead of just jumping on, do you have a plan? When are you going to do it, etc. Because oftentimes that'll shut them down, especially if this is really hard for them to come to you and tell you that. So just having a conversation and saying, what's going on? How can I help? And then based off of that, then moving forward with whatever access you need help with.
I would add to that the importance of sincerely expressing gratitude to your child for having the courage to talk to you about that, because it is a pivotal moment. If they don't feel that it was a safe experience, then they're going to be less likely to be honest with you about that in the future. So it's really important to make them feel listened to and loved and just fully heard.
When I'm working with teens, they can say some really surprising things that absolutely throw me off my game. And so I, in my work, rely heavily on scripts. So that is a way of having a practiced response that's not shock, because you can't necessarily sit silently gathering yourself for a really, really long time, because then they'll start to kind of fill in the blanks of what may be happening and that perhaps this was not the thing to say, and oh no, you're so mad. So if I can rely on a script of, that must have been really hard for you to share, thank you. I've said that because it's my automatic response, which is actually giving me time to think more about the individual situation that I'm in and how we're going to kind of progress. So some of those kind of canned responses or scripts can really help us feel a little more comfortable, give us some time and space to think of what we're going to say next, and make sure that we're responding in kindness.
This person would like to know, can you speak to the myth that once the emotional state improves, the risk of suicide is over?
Sometimes that can be the opposite, actually. If someone has a very clinically significant level of depression, and, say they are able to start a medicine or something that helps to alleviate that somewhat, sometimes the increased mood, the improved mood, the, improved motivation can actually be a risk factor. If someone was too depressed to make any plans to harm themselves previously.
Anyone else?
I think also that it's a risk factor when they start to feel better, because sometimes when you are that depressed and you can't make decisions, that you finally made a decision that you're going to go through it. And so then you're not as hopeless, and because that decision is in front of you. And so to have somebody go from super depressed to being a little bit more okay and managing is a sign that they may have made a final decision that they're actually going to kill themselves. They're not in that struggle.
Chris, what is the name of the outside organizations that assist Spokane Public Schools in investigations of suicide?
So it's through our insurance company, and it's our risk management group. And anytime we have a completed suicide, there are a plethora of reasons why they go in and do investigations, but that is actually one of the reasons where they would go in and look and see, why did a child kill him or herself? It's part of, and we always go in as staff and investigate that as well. Talk to kids. We want to make sure that really that bullying isn't part of it. I think that so many people like to place the idea of bullying on almost every suicide. For some reason, I don't know why, I think people like to try to put meaning to it, and we can never really put meaning to why someone takes his or her life. And so we really take every suicide in Spokane Public Schools very, very seriously, and we go in and we do a deep investigation about what was going on with that child. And actually, thus far, we haven't, since I've been in my role for 4 years, and we have lost far too many kids, we actually haven't found a direct correlation with bullying being a part of that decision for that child to take his or her life.
That concludes the note cards that we have, the questions that you jotted down, but we do have that microphone in the audience, and feel free to raise your hand if you have a question for the panel.
Chris, I was just wondering, on the investigation that you do on the child that commits suicide, who do you involve in that investigation?
We talk to the entire administrative team that works with the child, counselors, teachers, peer groups. We get on social media, we dig into their accounts, and it's really partnering with the parents. We do a full holistic look at the child just to make sure that we did not miss something as an educational entity to try to prevent further deaths in our district.
So you do involve the family?
Oh, absolutely. We partner with families. Yes. Yes.
Okay.
There are kids. And so we, anytime, good or bad, that we are able to partner with families, we absolutely do that.
Okay. Thank you.
Down here.
I just have a question. I think that a lot of what's been talked about tonight is reactionary. So I wonder what we're doing proactively in the schools to prevent these types of things from getting to the point where kids are committing suicide. So I think about sex education, for example. We're talking to kids about sex from 4th grade on. So when do we start talking to our kids about mental illness and mental well-being and being healthy from that young on, so we can reduce the stigma and also increase resiliency?
So that's a fabulous question, and actually someone else posed that to me earlier this evening at the resource fair. We're actually looking at different curricula that talks about suicide and mental health, and the adoption process for curriculum is a very thorough, timely process, and it's one that we take very, very seriously as a district. We want to be mindful and get evidence-based research, support, literature, curriculum, and so we are in the process of looking at various curricula to bring into our schools. We're also training our counselors on mental health and suicide prevention, and so oftentimes they're going in and doing small group support in the schools. They're doing classroom lessons. We get at that at a variety of other ways, but we are definitely looking at trying to bring curriculum into our schools. We need it. Schools across the nation need it, and so a lot of districts throughout the nation are kind of embarking on the same journey that we are in Spokane Public Schools.
Mm-hmm. Jill, I'm wondering, how young is too young to start those conversations? Or is there such a thing as being too young?
I would tell you my 5-year-old has had some of those conversations, and that's a personal choice in our family based on, what I see. But I think the more that we can talk with our kids about how do they feel and what was their experience like and how was your day, and to focus on what could have made your day better and maybe why was your day better than you thought it could be. The more that we can talk about feelings and emotions, I think we've gotten away from that, and sometimes we feel those as messy and icky, but the more that we can talk about it and have people be authentic and genuine and real, I think that's really important. We need people to be able to identify that so that they can be healthy and holistic in who they are.
Mm-hmm. After all, we take them to the dentist when they get their first tooth. We have them have checkups physically, mental health checkups. Should it be also part of the process? And we've separated the two, but physical and mental health should perhaps be part of one conversation. Nodding. Okay. We have another question.
Hi, my name's Nick. I'm with Children's. I'm a CPS investigator. And so talking with a lot of counselors and the resource officers, a lot of people are telling me that the social media, that's what they're seeing as a big issue when it comes to cutting and the suicidal thoughts that a lot of kids are having. Is this just across the board that's going on? Because I've been talking with some of the teens on my caseload, and even younger kids about when they encounter this, how does it make them feel? Is it this, like the cyberbullying that they can't get away from? Like what is really that is in social media that's really affecting everybody?
I would say if we knew the absolute answer to that, we would be like out there marketing it and patenting it and telling everyone. But I do think that social media raises a really interesting and new dynamic in our society that may not have had as much impact as it did 10 years ago. I think, for example, what we hear about is this social media allows us to just put up the things that are really perfect in our lives. So we have this perception that everything else is really perfect and we're the only one who might be struggling. So I think that is problematic, again, with that ability to be authentic, and we talk about a Facebook generation or what that looks like to only see a highlight reel of people's lives. So I think we are at an interesting place of what is our relationship as a society with social media and how do we make sense of that.
And I think a lot of the social media does contribute to, it's actually a trigger and to a trauma that I have experienced in the past. And I do believe, a lot of people do live in, social media too much, and that's kind of what they believe, and it does, I believe it does trigger past trauma and contributes to some depression or sadness that they have going on. And I've recommended some patients to decrease their social media, even looking at certain different messages. Sometimes some people say they have friends that just say how bad their day was all day, and and even stuff in the news. So I think a lot of that does contribute to a lot of those feelings, and just compiles. And if they're not able to really identify what their feelings and know how to cope, then it is going to keep, I think, eating them up.
And think about when, excuse me, Tom. Think about when we all grew up, we were outside playing, and I know that we kind of speak lightheartedly about that. We'd go outside and we wouldn't come back home until the sun was down, it was dark, and but there's really something to be said about being outside in nature, getting that vitamin D, breathing the fresh air, being in our beautiful world. And we have the highest numbers of students that have depression and anxiety, unprecedented from any other previous generation. And they are attributing it to phones, and part of it is kids aren't going outside and playing. They're not getting the fresh air. So put your phones away and say to your kids, let's go for a walk around the block. Let's take the dog for a walk. I'm going to take you to a new place. Let's go hike around the park. And so make a concerted effort to go outside with your kids. They don't know, a lot of them don't know that joy of playing outside.
And what I was going to say piggybacks well on that, I think, actually. One kind of common theme with social media is that it's really all tailored towards creating this very short attention span, right? So it's all these very brief, easily digested kind of things, right? And so what ends up happening is, when young people are having problems with their emotions, it's easy to kind of seek it out as a form of escape, and in turn you end up reinforcing that and becoming less able to tolerate being alone with your own thoughts, right? And your ability to engage in creativity goes down, right? So when we think about, the good old days when we all played outside, that kind of thing, right? A big component of that was creativity, right? A big component in wellness, all the way from, just getting over mild anxiety to healing from intense trauma. Creativity is a major component in that, and there's a lot of strong research that supports that. So, I think that's been part of the damaging effect of social media, is that it's robbed many youth of their creativity.
Does it also go to their coping skills then, at the same time? Does that become a component then, if they're locked into their phone or their device and not dealing with issues, they're not learning how to cope with those issues?
That's what I was just going to talk about, is it does become that fix, especially for kids that are dealing with depression or suicide or anything else that is difficult. It becomes a coping mechanism so they don't have to deal with it. It also disengages them from any connections. I worked with a young lady who was stuck on her phone all of the time, and they made her put it away at school. And one of the things that she said was, I can talk to people. They're not scary. And she didn't even realize that she had that ability to connect because she was so focused on those coping skills that that phone gave her. It was protection. And so it takes away their ability to be creative. It takes their way to connect to people. And yeah.
Very good.
And it takes away their ability to read social cues and nonverbal. 80% of what we say is through our nonverbals, and only 20 is our verbal, is what scientists say. And students are really losing that ability to read those nonverbals because it's through a picture on Snapchat or a text or an Instagram post. So our kids are losing out on real fundamental skill sets that we grew up and I think we've kind of taken for granted. And so we need to kind of go back to the basics and teach our kids how to communicate.
We have another audience question.
Along the same lines, I'm wondering, obviously you guys are describing the risks outweigh the benefits when it comes to social media, it feels like, when it comes to our kids. So how do we introduce social media in a healthy way to our kids, and at what age do you think that's appropriate? Or do we even, I know we have to, but I don't want to. So when do we have to do this?
Two kind of thoughts I have on that. When I'm working with families, I kind of use the analogy of candy, right? So you wouldn't tell your child you can never, ever have candy, right? But you also wouldn't let your child have 50 pieces of candy every day after school, right? So it's the idea of kind of introducing sort of controlled amount of time, introducing them to having a healthy relationship with social media, since it's, for better or worse, it's going to be something in their life. And then the other piece is, modeling as a family. So when I'm working with families, I always encourage parents, this cannot be one of those rules for thee and not for me kind of situations, right? And, if parents are also putting down the phone, then, that provides an opportunity to have better bonding connections as a family.
And another one I think is the child's developmental stage is also important. Kids don't usually develop abstract thinking until they're 12, 13 if they've developed normally. So I think that, going along with, getting outside, focusing on what's more age appropriate for the child, and especially when they're young, focusing on their physical and, family interactions, relationships. And I think that's a good way. And the model we use at the Native Project is kind of a medicine wheel. So we look at different components, physical, mental, spiritual, and also keeping that in mind, where the kids are at and what the family, what they function around. So for me, I would, suggest limited time, until they can start to have good coping skills, understand, have abstract thinking, and their sense of values are more intact, and their morals. We get a lot of, the wrong messages when we're in social media, even from movies. So I think that's important.
Very good. Any other audience questions? Okay.
First of all, I want to thank Chris, Spokane Public Schools, all the agencies that are here, the moderator, the panelists, for bringing us all together to further the conversation on suicide. And the question I have is, we're talking about prevention. Of course, prevention is always a cure. But let's say somebody a child has committed suicide. And for a parent, that is the most devastating thing that you can ever go through, bar none. what resources are available to families that has gone through or are going through this, because it's a lifelong process? What resources are available to help them to cope with this devastation so that it does not end up being a catalyst for another suicide?
Who would like to take that?
One of my favorite resources to reach out to, and people don't think of this one very often, I don't think, but Hospice of Spokane has a really fantastic counseling program, very specific to dealing with loss. There's also a support group through hospice dealing with loss. The one-on-one counseling can, of course, address issues specific to those questions that are always left when somebody has taken their own life. But being around people who, death is really taboo just in general. And so being around people who get it, who understand those feelings, who are going through those feelings as well, I think can be a really powerful thing.
Another question?
I have a couple questions, and then just also some things I was thinking as a parent from things you guys were discussing. First of all, I also want to say thank you for doing this. I think it's a great resource for Spokane. One question I had is, how did you guys market this? Did you market it to any of the parent groups, so more parents through the high schools or middle schools were here?
Chris?
I can speak to that because I took the lead on the marketing. It was sent out to all of our school leadership teams and counselors, and it was at their professional discretion how to disseminate that to their school staff. I made contact with all of the news agencies, and they've really been reporting heavily on it. Contacted Spokane Public Radio, and Steve Jackson spoke about this event. I did a radio interview with Teresa this morning. The Spokesman Review did an article on it as well, and we have been posting it on Spokane Public Schools' Facebook page as well.
And I wouldn't kind of limit it to that, but contacting some agencies and some, I know we are open to also doing small group discussions. Say if there was a parent committee that we were invited to talk at, we'd be willing to do something like that. So it doesn't have to be this grand, and it's always important to try to bring it up wherever we can. So I'm always willing to do things like this, volunteer my own time if it's going to contribute to the community, to the children, to families, whatever it is. So so reach out to, I don't know if you're connected with any agency or anything like that, but we'd be willing to do something like that.
So I don't want to dominate the question, or dominate the discussion, but just a few pointers, because through various situations, I've had about 7 years of different situations that have come up. One, you were talking about phrases that come up. I think it's important to just know changes in speech with your child too, because my daughter had a friend just recently after I went to one of the fail-safe presentations, which was wonderful and great to get information out to the community on how to talk openly, like Odyssey was talking about, talking openly and having some phrases that you might be comfortable with. Her friend just had a speech of saying, "I'm done." And later when I had to get his dad involved, his dad didn't understand and didn't think it was a big deal. But it was very much a change of speech for his son. His son was very goal-oriented before, very positive, always there for other people. And that phrase was huge for him, and it was very serious. And having to get Sacred Heart involved and getting other professionals, and luckily through the fail-safe presentation, knowing and learning about Frontier Behavioral Health Risk Assessment, which was crucial, and the national hotline was a great thing. So several of the services have been used helping my children's friends out. Also just important I think it's great to get your kid in the car wonderful, wonderful conversations in the car. I hate it when they turn 16. And they kind of make it a joke that you always wait for these important questions when the doors are locked and I can't get out. And I remember one really important, and I'm by no means perfect parent, I know that. But I remember a memory of us going to do archery because the kids' hands are busy. So they can't be on their phones, and we even went outside in the rain and did it. And it was a great memory, a great talking time, and the social media is so difficult now. And just a reminder that that TV series, 13 Reasons Why, is about to come out with their second season. And I know from listening to the kids in my car that every kid was watching that program. So.
Okay, thank you very much.
We have about 5 minutes left. So is there any last minute questions?
What would you say to parents who have never had this conversation with their children and they don't know where to start?
You know, that's a very good question. And where do we start? I think you just, start with talking about being here with your kids. Say, I went to a meeting today. It was very interesting. This is some of the topics that they talked about. Have you ever had friends that have expressed this stuff? Have you ever had friends that have cut themselves? So the best place would be to take what you learned tonight and start that conversation. It's just what you learned and see what they come back up with.
I think it's often a lot easier to start in asking your children about their friends than maybe to ask about themselves. But that's your entryway to themselves a lot of times, because it can feel really intimidating for them to talk about themselves, but they may be more open about, here's what I'm hearing about my friends, or here's what I heard about that 13 Reasons Why show, and that, what do you think about that? And then that can get more to the questions, the open-ended questions about how they're feeling, but sometimes finding that safe place that isn't directly about them is a great place to start the conversation, to be able to move it to more direct about them.
And I would add, by starting a conversation with your child about this, you're helping to kind of normalize that topic of discussion a little more, right? So they'll know that it's not as taboo, right? That it's not an off-limits thing, right? They're more likely to be comfortable coming to you to talk about that in the future.
Okay, I think we have time for one more question.
I'd like to ask Jackie, because you're there with the kids, and I have a teenage granddaughter, and friendships just don't seem to be like what they used to be. How are friendships, because of all this social media and kids just being connected with kids in the school, with kids in general, are they connecting with each other?
I definitely think friendships, they're not that strong anymore. I've lost some of the closest people I've been close with. And I think social media has a big impact on that, because you spend so much time with someone and you grow so close to them, and then a lot of teens, they'll feel lonely when their best friend leaves and they're not friends anymore. And I think that's one of the hardest things for a teenager. Like, I know there's school, I know there's tests, I know there's college, but losing a friend, and they'll feel so lonely, and that's when parents need to be there for them, because when they lose someone who they trusted, they trusted everything with them, and then all of a sudden they're lost and they're alone, and they need their parents more than ever.
Very good question. Thank you. The panel will be sticking around. If you feel like you want to connect with them one-on-one to answer your questions, you can certainly do that. Want to remind everyone, too, that this is being recorded. It's being live streamed, but also recorded, and will be available on the Spokane Public Schools YouTube channel. So maybe you can talk your kids into watching. You can certainly see, but it's certainly worth sharing with other friends and family, too.
So I know we've been focusing a lot on the kind of suicide and the downside, but I think beginning from as early as you can starting to help children develop their identity, protective factors, and I think that is key. So protective factors are things that help anyone in the state of thought of dying by suicide, that's something that's going to also be there that they can rely on, and you can also utilize to help them through their situation. So open that up in their social network as far as the support to family, appropriate friends, activities, groups, anything like that. So anything that you can do to increase that is very helpful, especially to clinicians, to recognize and to start from and work around that and strengthen that protective factor.
Mm-hmm. And Chris, maybe some final thoughts. This is really a great starting point. How do we move forward from here?
It's a big question. I just want to say thank you to everyone that participated and partnered in this. It really is a community effort, and I thank everyone and all of you that took your time to come here tonight and everyone that participated. We just have to be able to continue to reach out and talk and build relationships, not only with our kids and our kids' friends, but with one another, agency to agency, family to agency, school to agency. Life is about relationships, and we need to embark on this journey forward collaboratively, and it's all for our youth and our community.
Very well said. Thank you all for being here.